Jennifer Stevens, and I'm here today with Jeanine Niemoller, and we're going to talk about her amazing career here as a Wyoming nurse. And this is Olive.
My mother, when I was a young girl, was diagnosed with a brain tumor and had open brain surgery back in the late 50s, and was then paralyzed and had a very difficult time. Was in the hospital for 3.5 months, I think. And so that's when I decided I was going to become a nurse. And so I never had to question, what are you going to do when you grow up? I just was going to be a nurse, and that's how it's happened. When I went into nursing, my intent was to be maternal child health. And because the doctors I worked for were OBGYN doctors. So that was my intent. And while I was in school, I did my public health rotation and was the first honor, I guess, that came up was that I was nominated for the Gertrude Gould Public Health Nursing Award. And that reshaped my intent. And I then applied for and became, as my first job, a public health nurse when I got out of school.
School from 72 to 81. Graduated with a bachelor's of nursing from UW. And in 81, did they have the willow ceremony then?
No.
No. Did they have a pinning?
They had a pinning.
Okay. And did you have to recite the pledge? The
Yes.
Nightingale pledge?
Yes, I did. And it was in the Arts and Sciences building where it is today. I go to those because it's so meaningful to me, because I remember we had to wear white uniforms and were pinned. As I got my master's, I became acquainted with Mary Berman, and Mary Berman became, when I was out of school, an incredible colleague. And it started because she took care of my mother as a practicing nurse. When she came back to Laramie and started teaching at the University of Wyoming, she also did home care. And she was my mother's nurse. And I can remember, and I told her this at her retirement, that my mother called me after Mary was out to see her the first time, and she said, Jeanine, she said, I have met this nurse. Her name is Mary Berman, and she's as good as a doctor. And I said, Mom, she is a doctor. She's a doctor of nursing. I believe that nurses need additional education. We should never stop learning. We always need to learn. And in this day and age, with the way the finances are in the world, there is no way that hospitals and employers of all kinds are going to send people to national meetings. And you know, I have a computer upstairs. I use it every single day. I Zoom until some days my backside is flat. I Zoom all the time. But there is nothing like a national meeting to reinvigorate yourself and understand.